Hello, everyone. My name is Dr. Reeve, and today I am going to tell you about which natural ways there is to prevent high blood pressure or to lower your high blood pressure. We all know that high blood pressure can be a danger to our health and heart. Therefore, it's very important to take care of your health by looking after our blood pressure. Have you been diagnosed with high blood pressure and are wondering if there's anything you can do besides taking medication to manage it? Well, you're in the right place because I'm here to share some valuable insights. Did you know that kidney specialists, not just cardiologists, are often deeply involved in treating high blood pressure? It's a surprising fact, but one that underscores the complexity of managing this condition. So what is blood pressure? By blood pressure, we mean the pressure with which the blood in your blood vessels presses against the walls of the blood vessels. Blood pressure is caused by the contraction of your heart muscle. This contracts about 60 to 100 times per minute and sets your blood pressure in motion. While your blood pressure serves to pump blood around your body so that your muscles and organs receive enough oxygen. Your blood pressure is displayed in two key figures, the upper pressure and the lower pressure. These are separated by a slash. The upper pressure is the pressure on the vessel walls when your heart contracts. This value is always the highest. Between two heartbeats, your heart muscle relaxes and the pressure decreases. This value is the negative pressure. Your upper and lower pressure are indicated in millimeters of mercury pressure. What is high blood pressure? We speak of high blood pressure, also called hypertension, when your blood presses too hard against the walls of your blood vessels. You have high blood pressure when the upper pressure is higher than 140 mercury, or the negative pressure is higher than 90 mercury. For people who are 60 years or older and healthy, an upper limit for the upper pressure of 160 mercury applies. Generally, you do not feel that you have high blood pressure, so you experience no obvious complaints. But even if you don't notice it, in the long term, high blood pressure is indeed harmful to the body. High blood pressure is a risk factor for cardiovascular disease. Only if you have extremely high blood pressure can you experience symptoms such as dizziness, headache, restlessness, shortness of breath, poor eyesight, chest pain, confusion, palpitations, nosebleeds, fatigue, nausea, and vomiting. To determine the cause of high blood pressure, a blood test is initially done. In most cases, there is no clear cause. Heredity may play a role, and high blood pressure is also more common among the elderly. This is because the blood vessels narrow or calcify with age. In about 5% of cases, high blood pressure is caused by a kidney disease, such as kidney inflammation, adrenal gland disease, or a congenital kidney defect. A narrowing of the renal artery or the large body artery, aorta, can also lead to high blood pressure. However, these causes are rare. Who is more at risk for high blood pressure? There are a number of factors that can increase the risk of high blood pressure. You are more likely to have high blood pressure if you have an unhealthy diet, if you smoke, drinks a lot of alcohol, does not exercise much, if you are overweight or being stressed, has a family history of high blood pressure, if you are older, are in menopause, has diabetes, or if you're pregnant. Pregnant women with high blood pressure have a greater risk of developing cardiovascular disease later in life. This is especially true for women who experience preeclampsia during pregnancy. Women with preeclampsia also have a greater risk of cardiovascular problems in the future. How can you measure high blood pressure? Your blood pressure is not the same throughout the day. To determine whether you have high blood pressure, you must measure your blood pressure at several times of the day. This can be done with the help of a blood pressure monitor. This is put on at the height of your upper arm. High blood pressure must have been measured on at least 3 occasions. That is why a doctor often opts for a 24-hour measurement. You then have to walk with a blood pressure monitor around all day. This then measures your blood pressure at different times. Do you want to measure your blood pressure once? This can be done at home or at the doctor's office. Your blood pressure is often a little higher when you visit the doctor because you may be a bit stressed or nervous before the consultation. Before we dive into the top 5 strategies to reduce your blood pressure naturally, let's briefly touch upon the role of medications. Undoubtedly, prescription drugs are incredibly effective at managing high blood pressure. Regular use can significantly lower your readings, overcoming common obstacles like side effects, costs, and accessibility issues. If you have access to these medications and can handle them without difficulty, they are a proven method to keep your blood pressure in check. Now, let's explore the natural methods that can help you control your blood pressure without relying solely on medication. The first one is exercise. Think of exercise as a universal remedy. While it's unclear which specific type and duration of exercise are most effective for lowering blood pressure, the benefits are undeniable. Starting a routine today, whether it's walking, cycling, yoga, or jogging, can lead to significant improvements. Regular physical activity, about 30 to 60 minutes 5 times a week, can reduce your systolic blood pressure, the top number, by 3 to 6 millimeters of mercury, which is comparable to the effects of some medications. The key is consistency and gradually increasing the intensity of your workouts. The second one is weight management. Losing weight is easier said than done, but it has a direct impact on blood pressure. Studies have indicated that every kilogram, approximately 2.2 pounds, lost may reduce your blood pressure by about 1 millimeter of mercury. While individual results vary, the overarching message is clear. Maintaining a healthy weight is crucial. Even preventing weight gain can be considered a success and beneficial for your blood pressure. The third one is to quit smoking. Smoking has an immediate effect on your blood pressure, causing a significant spike with each cigarette smoked. This increase can last up to 20 minutes after smoking. Regular smoking throughout the day leads to sustained high blood pressure, along with increasing the risk of heart disease, stroke, lung cancer, and chronic obstructive pulmonary disease. Quitting smoking is one of the best decisions you can make for your heart health and blood pressure. Fourth one is to reduce salt intake. Many people with high blood pressure have salt-sensitive hypertension. Reducing salt intake can lead to marked improvements in blood pressure levels. Start by adjusting your palate and preparing more meals at home, where you can control the amount of salt used. This simple change can make a big difference in managing your blood pressure. The last one, increase potassium intake. For those without kidney issues or high blood potassium levels, incorporating more potassium-rich foods can be beneficial. Potassium is a mineral that, together with chloride and sodium, is involved in regulating fluid balance and blood pressure. In addition, potassium, together with sodium, ensures that nerve impulses are properly conducted and muscles contract. Potassium is mainly found in vegetables, fruit, potatoes, meat, fish, nuts, and also in dairy products and bread. Foods like sweet potatoes, spinach, bananas, oranges, mangoes, and tomatoes can help reduce blood pressure and lower the risk of stroke. A potassium deficiency can occur after severe vomiting, severe diarrhea, and the use of diuretics. In case of a potassium deficiency, it is important to only use potassium tablets in consultation with the doctor. High blood pressure affects nearly 1 billion people globally and increases the risk of many diseases, from kidney disorders to heart conditions, and even dementia. There's some debate over the precise definition of high blood pressure, with some guidelines setting the threshold at 130/80 mercury, while others recommend maintaining levels below 120/80 mercury. Regardless of these variations, the goal remains to keep blood pressure well controlled, ideally below 140/90 mercury for most individuals. By adopting these lifestyle changes, you can take significant steps toward managing your blood pressure and reducing your risk of related health issues. Remember, each small step can lead to substantial health benefits over time. Thank you all for watching. Please stay tuned for more health updates.